will call on Ms. Balint from Vermont. The gentlelady is recognized.
Thank you, Mr. Chair. Thank you, Director Young, for being here. As I'm sure you know, this week the Republican majority is bringing a bill to the floor that would put a very large burden on schools and families. It would condition federal funding for schools on implementing policies that will actively harm LGBTQ students. And we're only in DC for a few days this week, and we're spending our valuable time on a bill that would insert the federal government between parents and kids and local schools. It promotes censorship, it promotes book banning, it violates the privacy of young people, and they say it's about freedom, and they say it's about protecting kids. And I have to ask, what about book banning is about protecting freedom, and what about defunding schools is about protecting kids? And I can tell you, this is not how my constituents want me to be spending my time. I was back in Vermont last week, traveling around the state, and we talked about a lot of urgent issues facing families in Vermont: housing, mental health, protecting social safety nets like Social Security and Medicare. We talked about how we have to do more right now to support mental health in schools. And not one person, not one, in all of my travels around the state advocated for less funding for schools. I met with so many high school students last week, and what they told me clearly and directly is that they need us to support them in meaningful ways, especially when it comes to mental health supports. And American families across this country are facing these urgent problems. The Center for Disease Control and Prevention just released their Youth Risk Behavior Survey results, and the results show that teen girls and LGBTQ teens are experiencing extremely high rates of mental distress, violence, and substance abuse. 3 in 5 girls feel persistently sad and hopeless, which is a marker for depressive symptoms, and more than 1 in 4 girls report that they had seriously considered suicide in 2021, 1 in 4. This is a substantial increase from 2011. And we have House Republican leadership ignoring this epidemic and instead pushing H.R. 5, a bill that stokes the fire of division instead of uniting us around this issue that I know that Republicans across the aisle also care about: the mental struggles of families in their community. So I want to know why we're not talking about that more. Our kids and teens are suffering. We need real investments in mental health care. And as a parent of school-aged children, I can tell you that is what parents are talking about right now. That's what they're talking about. So I know that Mr. Trone asked about mental health supports. I wonder if you could go back to the president's budget and talk a little bit more about what families and students can look for that will give them hope in this budget around these issues. Thank you.
So that sobering reflection makes me want to put my 16-month-old in a bubble because this is a hard time for young people with social media, and I think many of us who grew up after it wonder how we would have done during this time. And I take this very seriously, and I hope there's bipartisan support to grow the Title I budget, which says it should not matter what zip code you live in, you should have access to a good education in this country. That's an economic argument as well, in addition to just a compassionate one. We also have increases for IDEA, which has been bipartisan in nature. And we have a proposal I hope we take seriously on pre-K 3 and 4, getting kids educated in the system earlier. We think it's critical. It's economics. You want more people in the labor force, let's educate them. And it shouldn't matter what zip code, they should have a basic education at a certain level. So that's what this budget does. And I hope we can come together and find some common solutions to, in many ways, what you laid out, a crisis for our kids at that age.
Thank you so much. I yield back.